Okay, for anybody who's had a thyroid issue or thyroidectomy, this is a series of maneuvers that will help immediately. So what we're going to do is we're going to work on the hands first, and the reason why the hands is they're connected with all the organ and meridian pathways up to the neck and into the head. And of course, all the organs and meridian pathways come up through here and up through here, causing constriction of the thyroid, causing either hypo or hyperthyroid. So we're going to start off with just doing a couple quick exercises. Now I'm going to walk through these and show you them very quickly. You're going to hold them longer. The very first one is finger torque. You place your hands in front of you, take your right hand and put it out, take your left hand, grab the fascia around the thumb, and you're going to rotate the thumb all the way away from you. You're going to pull your finger apart, and then it's like you're pulling them apart, literally like you're pulling your elbows apart. And with that tension, you're going to slowly rotate your body upwards to the right, pulling your elbow back, and then turn your head to the left. And you're going to take deep breaths. And I would alternate between mouth breathing and nose breathing, and then bring it back. Now it's the first and the ring finger go the same way. So the ring finger, you turn, pull apart, rotate, pulling your right elbow around, and turn your head to the left, and breathe again 8 to 10 times. Now these three fingers go the opposite way. So index finger, you pull, you grab it, you turn it towards yourself, pull apart, then rotate and breathe. Again for the middle finger, pull apart, rotate and breathe, and then the ring finger. You do the same thing on the opposite hand and just the same general direction. Now remember, the thumb and the forefinger roll away from you, and then every other one rolls back. The other issue that we're going to be dealing with specifically, because with a thyroid issue, you usually get a lot of tension in the back of the neck and the shoulders. So one of the eye issues that come up is a restriction of eye movement. So in the eye movement program, what we're going to do is we're going to focus our eyes on one of the fingers. So we're going to move our right hand first, and we're going to focus our eye on the left finger, and you're going to keep your nose aligned with your hand, and you're going to keep the hand exactly at 90 degrees to the nose. So you're going to then move the right hand out, and you keep this in your peripheral just with your eyes, and then you move back. So you have your eyes try to follow and track it all the way without moving your nose. You do 8 of those, 8 of those, 8 of those, and then you do it with the other side, 8 of those, 8 of those, and 8 of those. And you'll find that your eyes don't always track, but you always want to keep them tracking as best you can. When you're finished that sequence, you're going to do a figure 8, taking from your nose. You're going to go down, and it's an infinity or an 8 lying upside down. And you just look at your eyes and do that 3 times. Super important, because eyes and vestibular issues become a real issue once you've had a surgery or a thyroid problem. One other one we're going to do is a quick vestibular issue. You're going to take your thumb, you're going to put it 6 inches from your nose, and it's level with your nose. You're going to turn your head, but you're going to keep your eyes focused on the thumb. Turning the head, keep the eyes focused. When you get out of focus with your outside eye, you close your eyes, keep them closed, keep them closed, keep them closed, come back to what you feel center is, and then open again. You can do the same thing with the other side. Closed, and then open. This is a little bit more tricky, but it's super important. The next thing that we're going to do is we're going to actually do a shoulder rotation. Now, if you're by yourself, you can do it this way. It's much better if you get somebody to stand behind you and just turn your shoulders like this. But in the event, we'll do one at a time. You're going to put your hand on your shoulder, and you're going to rotate the thumb towards you. You're going to turn your head into that rotation, and you're going to turn your body away from the rotation. And so what happens is you're going to lift. You can even accentuate it by lifting your shoulders, but you just breathe basically. And again, you're taking all those meridian pathways and you're opening them up. Same thing on the other side, hand here. And you're really on the shoulder capsule. You're not here, You're not there, you're on top of the ball. So you're turning it like a ball, turn your head into it, and then rotate. Okay, there's a couple other quick things that are really good for this. Again, these are extras but not required. If you take and do the seated swinger position, so you take your left hand, put it on your right shoulder, take your right hand, put it on the elbow, grabbing the fascia, pulling your body around to the right and your head to the left, that'll help out. And while you're seated, you're going to get an extra emphasis on the upper shoulders. And doing the same thing on the other side, right hand here, left hand here, pulling around. Again, now, if you have the ability to do your toes and you can touch them, the same thing with the toes, but it's the big toe and the little toe are opposite to the hand. So it's just the same rotations, but opposite. So like the big toe, you're actually turning outward and pulling. And if you're here in that position, you can actually still pull your knee apart. And then your ring toe, you're turning towards yourself and pulling apart. And then these three, you're turning away from yourself, pulling apart, pulling apart, pulling apart. Now, if you can't do that, you can have a partner do that for you and simply pull. And the last one is directly for the thyroid. What you're gonna do is the tension on the thyroid, especially if you've had a thyroidectomy or a partial thyroidectomy, there's gonna be a lot of surgical tension in through the fascial area around here. And this is super important because the bones that are in here tell the neck where it is in space and time, left and right. So you're gonna take your left hand and you're going to pin the fascia right at the clavicle. So right here at the clavicle, you're gonna push in there and grab it, pulling it down a little bit. Take your left hand and you're gonna take on either side, not to choke yourself, but a good amount of tension, and you're gonna push in and you're gonna push the skin apart and then up. And you're gonna stretch up. And you're gonna breathe. And you should feel some relaxation in the tailbone area. Last thing is to activate the thyroid. Take your left hand behind you and your right hand before, slightly pulling up the skin. Breathe. And as you breathe, you connect the hands together and you'll feel your neck soften. You do that 10 times. These are the primary directive exercises for the thyroid, and you also get head, neck, and shoulders in there. And a lot of the meridians that get caught up in tightness in the neck will start to go away. You can add one last thing to this, is to take your hands around your ears. It's a full ear pull, so grabbing the entire ear. And you can see this all in our facial alignment classes. And then what you do is you rotate the ears forward so you're stretching them. Open your jaw 3 times. Put your head down. Put your head way up and rotate more. Turn your head to the right. Turn your head to the left. Thyroid issues start to go away real quick. You'll feel a relief the first time you do this. Thank you.